Back now on Most Buffalo, the town hall. We heard today from UB scientists who are concerned that this latest spike of the Delta variant could continue into the fall and winter, especially as we spend more time inside. They presented their models today, along with the Erie County Health Commissioner, Gail Burstein, who says 40% of cases they're seeing right now are in people who are vaccinated. She says most of those cases are mild and that it shows the vaccine is still keeping people out of the hospital, but that it should be a reminder to vaccinated people that you are not immune and can still spread the virus.
I think if people are smart and wear their masks when they go to these entertainment activities, physical distancing as much as they can. Hopefully, they can choose to participate in outdoor activities while the weather is still nice compared to indoor activities, and also just be a good citizen. And if you are feeling ill, just skip it. Just don't go and get a test and know your status.
While Burstein didn't announce a vaccination mandate for schools, she did say one would be effective. Well, it comes a day after President Biden's announcement requiring all employers with at least 100 workers to mandate vaccines or get their workers tested. A lot of the response to that has been questioning whether it's actually legal, and that's something our Verify team looked into.
So first, can the federal government require that federal employees get the COVID vaccine? And second, can they require that private employees get vaccinated? So let's start with federal employees. We spoke with Lawrence Gostin from Georgetown Law and Stephanie Rapp-Tully, a federal employment lawyer based out of D.C. And both say, generally speaking, yes, the federal government can require its workforce to get the shot.
The Equal Employment Opportunity Commission and the Department of Justice have both said that it's lawful to do it. And there are federal courts that have upheld other workforce mandates.
Rapp-Tully says there are exceptions for those with medical or sincerely held religious objections. Another caveat here, unions. Rapp-Tully says the federal government would have to negotiate an agreement with them in order to avoid litigation. So yes, in general, it's legal for the president to mandate that federal employees get the vaccine. So let's get to that second question now. Can the federal government require that private companies vaccinate their employees? This one is a little tricky. We asked Lawrence Gostin, our global health expert, and two constitutional law experts, Robert Peck from the Center of Constitutional Litigation and Trevor Burrus at the Cato Institute. So Gostin and Peck say yes, this rule has legal precedent, including in the Supreme Court. But meanwhile, Burrus says no, the president does not have the constitutional power to make you get a vaccine. So without a consensus, we can't verify an answer on this right now, but Peck says we are likely to see this one fought out in the courts. With your Verify, I'm Adam Longo.
And ever since people started talking about vaccine mandates, we've all heard a lot about HIPAA. Most of it not correct. The Verify team also looked into the question, does that law protect your vaccination card? Our sources for this are the Department of Health and Human Services and Kate Spector-Baghdadi from University of Michigan's Center for Bioethics and Social Sciences in Medicine. So according to HHS, the Health Insurance Portability and Accountability Act, or HIPAA, only applies to covered things like doctors, hospitals, and insurance plans, so they can't share your personal health information without your permission. Because of that, Spector-Baghdadi says that if your doctor has your vaccination information, they cannot share it with other people without your permission. But this does not prevent other places like restaurants or stores from asking you for it or from telling you that you can't come in without showing it. So we can verify, no, your vaccine card on its own is not a HIPAA protected document.